Did you know that 4 in 5 households raise families that are not planned for? Did you even know that this situation could be avoided if family planning methods are adopted? Today on the program, we are taking a look at family planning, the essence and types that we have out there. Good evening, welcome to the program. My name is Olasumbo Modupe and you are watching Sound Health on Lagos Television. The conversation begins after this break. Please stay tuned.
Mpox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 14,000 cases and 524 deaths. WHO has been working on the Mpox outbreak in Africa and raising the alarm that this is something that should concern us all. The committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law. The emergency committee's advice to me and that of the African CDC Centers for Disease Control and Prevention, which yesterday declared a public health emergency of regional security, are aligned. WHO is on the ground, working with the affected countries and others at risk through our country and regional offices, as well as with partners including the Africa CDC, NGOs, civil society, and more.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Juliana Idowu, a retired registered nurse and state trainer, as well as service delivery consultant with the Challenge Initiative, and she is going to tell us about family planning. Good evening, Juliana Idowu Okanlawon, and thanks for joining us.
Thank you, the moderator, and good evening, viewers at home.
When families plan, community prospers. Tell us, what exactly is family planning? How do we achieve prosperity in our community and society at large?
Family planning is a way of life adopted by people for their own comfort, and it is safe. It is a free of choice, and we say family planning is a method whereby the couple or an individual choose to space the number of children he or she or the couple decides to have. Family planning does not say you should not have children. Rather, it is emphasizing on you spacing the childbirth, spacing the number of children you want to have. So in summary, we say family planning is having your children by choice and not by chance.
All right, thank you for that explanation. But how do you plan? Do you just wake up one day and say you want to plan? Is there a procedure? Are there steps to follow?
Definitely there are. By family planning, like I said, it could be by a couple, it could be by an individual, it could even be embraced by youth. Once you know you are sexually active, you are advised to go on a method of family planning. So if you want to do family planning as a couple, they need to sit down together, know the number of children they want to have, the space intervals at which they want to have these children, then they visit the nearest health facility closer to them. Or if you are a youth that is, you know that you are sexually active, instead of having unwanted pregnancy and having abortion all the time, it is safer for you to go and do family planning. And if you are a single mother too, and you know you cannot hold body, it is safer for you to go and do family planning. So for you to do family planning, there are steps to it. You as the person or the client, you go to the closest health center or health facility or general hospital closer to you where they offer the services. Visit them where they will counsel you. They will counsel you on all the methods of family planning we have, and they will give you informed knowledge you need to know about family planning, and that information will guide you in choosing a method suitable to you. That is to say, we don't coerce anybody to do family planning. We don't force any method on anybody. Rather, we help you to make an informed choice to making a suitable method.
All right. What are these methods now? What are these methods now? All right.
One of the methods is natural method. And by this natural method, we have it in two ways. You have the calendar method and abstinence. By abstinence, we mean total asceticism. You don't have sex at all. If there's no sex, there's no how you can be pregnant. So you don't think of any pregnancy or wanted pregnancy. So if you can stay without having sex, that's a method of family planning. Then another method of natural method is a calendar method. By this calendar method, that is where you assist the woman or the lady to study her body chemistry so that she will know when she's ovulating. When she's ovulating is the time she produces egg. And this is characterized by the mucus. That is the mucus discharge coming from the woman's private parts, and it is like the egg white. We assist the lady to know exactly how to look out for the ovulation period, and if she can do it religiously, she can use that as a method. And this particular method, that is the calendar method, is really embraced by the Catholics and some religious body as well. Then under the methods too, we have the one we call implants. By implants, we have two methods. The one for 3 years, that one consists of one rod, and the one for 5 years consists of 2 rods. So, and this is to the layman or the lay person, we call it onishano. It is embedded under the skin of the hand. So that one, the person that carry it for a period of 3 to 5 years, depending on the one she has chosen. Then we have the one we call LAM. LAM means lactational amenorrhea method. That is for a pregnant nursing mother that just put to bed and is breastfeeding religiously. No water, no anything mixed with the breast milk for the baby. So, and this is acceptable for the breastfeeding mother for a period in the first 6 months of childbirth. After which she can change to another method that we call tablets. So under the tablet, we have the mini pill. The mini pill is also used by the nursing mothers for the first 6 periods after childbirth. After 6 months, then she changed to the combined tablets, which consists of estrogen and progesterone. After that, we have the injectables. The injectables is of 3 times. The 2 monthly, which is non-steroids, and we have 2 times for 3 monthly. That is Diana Press and Depo. The Depo is given by the health worker into the muscle, whereas the Diana Press is self-inject. So the Diana Press is introduced for the comfort of these clients, so that by the time we teach them how to do self-inject and they are able to do it without any mistake, then they can be given the one that will last them for a period of time without coming to the hospital to refill on frequent basis. Outside that, we have the one that we call IUCD. IUCD is otherwise known as Showambe. They call it Showambe because at the end of each menstrual cycle, the woman has to go into her private part with the tallest finger to examine or feel for the string, that is the rope attached to the IUD, to see whether it is still in situ or it has fallen out. Because in some people with heavy messes, it can fall out. That's why they need to check at least the second day after they have ended their messes. That is why they call it show and string, that they are looking for the Once they see it, that means it is still there. Then there's another one who's called permanent. The permanent is usually done by whoever has completed his or her family. The men can do it, the female, they can do it. The one done by the men is called vasectomy. And the one done by the woman is called tubal ligation. Both is a mini surgical operation, and we don't do it for anybody without their consent. For whoever wants to do the permanent method, it has to sign a consent form, and they give them time to really think about it before it is done on them. Because once you have the permanent method done, it is irreversible. You can never come back to it and say, I don't want again. So that is why we give them ample choice to really go back and think about it before we do it for them. But it's a method and it is permanent. We call it pariola in the sense that once you do it, you cannot come back to it that I want to reverse it. Then there is another one we call condom. We have condom. We have male condom and we have male condoms. The male condom is worn by the male, and when they come to the facility to collect, we teach them how to really do proper application of the condom. Because if you don't apply it well, there could be mistakes, which can eventually lead to error in application and can make the person be pregnant. And there is female condom too. The female condom, when they come to the facility to collect, we teach them how to apply it, so that they don't have error in application and they don't come back with pregnancy.
Okay.
So,
all right. How do you tell which is the most suitable? Because you have so many of them, so many options to choose from.
We don't coerce anybody and we don't choose for anybody. Rather, we give them proper counseling. Counseling, we mean when you give them adequate and necessary information they need to know of all the methods. Having done that, you examine the client to know which one is most appropriate or more suitable to them, and whichever method they choose is the method suitable to them.
Okay, maybe
and we must rule out there is no pregnancy by doing pregnancy tests before commencement of any method.
Okay, maybe the appropriate questions I should have asked. I should have asked for side effects. Are there side effects? How do you tell a partner or a user, a prospective user, that this is the right method for you?
Thank you. If I should tell you there's no side effect, I'm telling lies. There are side effects to all the methods of family planning. Even the food we eat at homes, there are side effects. When you eat too much, you have the side effects. Even common water, if you drink too much of water, you have side effects. So also the methods of family planning. But the good thing about the side effects of family planning is that all the side effects are treatable. There is no side effect that cannot be managed. They are all treatable.
Okay, are they life-threatening?
None of the side effects is life-threatening. The ones that people really talk about is excessive bleeding. And by the time they are coming to the clinic for any method of family planning, if they have been counseled properly, because counseling is the bedrock of family planning. So whoever is coming to you for the first time on family planning, even subsequent visits, you still need to counsel. That is, you need to tell them, you talk to them, things they need to know, things they should expect when it comes, how to manage it. But when the bleeding is now becoming too much, to the extent that the woman is feeling dizzy, and instead of changing her pad 3-4 times a day, she's now changing pad 6-7 times a day, we tell them they should come back to the clinic. So when we see that it's life-threatening or it's more than what the person can bear, then we change the method. but none of the side effects is life-threatening per se, and they are all manageable.
All right, is this a fact or a myth? Oftentimes we hear people say once you are on any family planning method, to be fertile is difficult. And if you're breastfeeding, you cannot be pregnant. There are other myths out there, but because of time, I would like you to address these first two that I asked now.
The myths and misconceptions, these are facts that are not true. And these are mere hearsay that people they hear from friends, maybe from community or from social media, which are really not true. And we do tell them that they need whatever they hear or they are confused or they are not sure about, they should come to us. Then we'll really expatiate for them. Sincerely, all the myths and misconceptions, take for example, some people will tell you when they are family planning, they can never be pregnant. It is not true. You return to facility immediately or as soon as that method of family planning is discontinued. Take for instance, I have a friend. Our own national method of family planning is having children every 6 years without even being on any method of family planning. That is to tell you about her body chemistry. So whether family planning or no family planning, there are some people like that with that type of body chemistry that even when they have a child to them, for them to have another child, maybe another 10 years, that is the way God made them. I'm not God. I'm not saying it is right, and I cannot blame God, but there are some people like that. So there are some people, it's not even the family planning that is making them not to return to fertility immediately, but with family planning, immediately you remove the method you are on. As soon as you remove, you return to fertility. And one thing about family planning is that even those people with infertility, we still use this family planning method. That's one good thing about family planning. The family planning they are running for, when they have infertility problems, we still use it to treat them. Like some people, when they have blood tubes, we still use this copper T to treat them, or when they have addition in their uterus. Some people, when they have irregular menses, or when their menses is not even coming at all, or they don't have menses at all, we still use pills to correct. So that's one good thing about family planning. That is to say, we can use the family planning to prevent pregnancy, as well as we can use the family planning to treat infertility. That's one good thing about family planning.
All right, because
so in essence, family planning does not make anybody to be infertile.
All right, because of time now, we'll come back in a subsequent episode to look at the myths and misconceptions. Let us know the benefit for a woman, a man, and the family or society now.
Under the benefits of family planning, I'll put it under 5 major headings. 1, to the woman. You know, it's the woman that bears everything. It's the woman that carries the pregnancy. Is the woman that bear the bodies most times in the house. So the benefit to the woman first. So to the woman, you know, if you space your child, if there is space between each child, the woman will be able to recover fully from the effect of the previous pregnancy. Then she'll be able to plan her life. If probably peradventure the first pregnancy was by a mistake, immediately she has that baby, she will go into family planning, and she decides to go to school. She can still have a normal life, have her education, at the end of the day have a good job, by which at the end of the day she can even support her family, and she'll be useful to herself and to the community. Then we say to the husband, you see, when the family, they agree and they have a method of family planning, the husband, the wife, and the children, they'll be healthy. The husband will not have hypertension. The tension of going home, and maybe if I should meet my wife now, she'll be pregnant, that fear will not be there again. The man can afford to send the child to a very good and standard school. Then the benefit of the community. You see, when you have the number of children you can adequately cater for, the number of touts in the community will reduce. The number of thuggery in the community will reduce. The social amenities within the community and the country at large will be able to go around. Then to the country, there will be less population, then the amenities they have will be able to go around, there will be good work. The number of work available can go around the populace. So in the nutshell, it's very important to have a family planning done. Take for instance, like a month ago, there's a family, they brought themselves to the health facility. The couple, they already had 2 children. Now they are thinking of having the 3rd child. Instead of a single baby, they have 4. In fact, it was the husband that brought all the 4 children and the wife. That today, they must do family planning. He's afraid of even having anything to do with the woman. So that is how it is. Nigeria of today now is simply encouraging people to go on family planning because the things are not that palatable again. So you don't even need to force anybody to do family planning now. It's everybody that is aware that it is necessary for them to do family planning. So family planning is very, very important for the people to do family planning so that whatever resources they have can go around and they can live a better life. And the rate at which they'll be falling sick will reduce because they can feed adequately, so their immunity will be increased.
All right, your final words, your calls to actions to viewers at home.
First of all, to TCI, the Challenge Initiative, we need to thank them because they have been a very good partner to Lagos State in the space of family planning services. You know, they partner with Lagos State, and in the concept of the partnership with Lagos State, they supported, they are supporting 126 private, 126 public facilities in family planning services and 67 private in family planning services so that they can be easy access to family planning services at free of charge. Aside that, they do regular reorientation of health workers, the mobilizer, the health educators, because these people, the health educators and the mobilizers, they are the closest to the community. So they have one-on-one interaction with the people in the community to sensitize them about family planning so that they would see the importance of them going through family planning. So to cram it all, I will advise the populace, our people, that to do family planning is not a death sentence. And family planning does not say you should not have children. Family planning does not make you infertile. Family planning rather helps you to live a good life and have the number of children you want to have at your own convenient time.
Family planning is not a death sentence. A planned family is a happy family. You need to embrace these methods for expected or desired outcomes. Juliana Idowu Okanlawon, retired registered nurse, state trainer and service delivery consultant to the Challenge Initiative. Thank you so much for your time and expertise on the essence of family planning.
Thank you.
Sound Health continues with trending health report from around the world. Please stay tuned. has been Sound Health on Lagos Television, and we have been looking at family planning, the essence of family planning, benefit to the family, the society, and country at large. There are so many methods out there. You need to choose a method that suits you. Family planning is all about choices. It's all about planning for your future. Make informed and healthy decisions out there. Go to your nearest health facility to pick one method that suits you. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.